The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Happy New Year. That's right, and welcome to Season 4 of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Wednesday, January 6th, 2021. Now, wait a minute. I know you're saying, well, her show usually comes on Friday. Yes, you are correct, and you will be getting another episode on Friday. But I wanted this one in particular to come out on January 6th, 2021. And I'll tell you the reason why at the end of this episode. Now, 2021 should be about two things: investing in yourself and becoming financially literate and stable, and becoming healthcare literate. That's right. Now, to break this down in layman terms, if 2020 taught you anything about life, it should be to stop depending on others for your security. And what I mean is your financial security and the security of your health. It is time for everyone who is listening to me to step up to the plate and handle your business. 2020 should have opened your eyes, mind, to never, ever be dependent on others, especially the government, for your financial and healthcare well-being. The part where I come into play is about your healthcare literacy. So, you know what I want you to do. That's right. All the way from the United States to Faroe Islands. Get ready to grab your cup of coffee, your cup of tea, and to my listeners who listen late at night. Now, you know I appreciate you, so get ready to grab your favorite glass of wine and join the conversation right here on My Story Living with Lupus podcast. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me, and I had to look for another alternative. And that's when a friend of mine turned me on to Goli. Goli is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goli is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goli promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goli, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goli for yourself. Here's a promo code you can use. It's SUELYN1. That's SUELYNNE1. And you'll receive 5% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goli. Allow me to ask you this question. When you go to the doctor's office and the doctor is talking to you about your conditions and your plan of care, what do? Do you just sit there and say nothing? Do you question the doctor? Or are you just comfortable that someone else, I'm talking about the doctor, is dealing with your health care issues to, give your mind a little rest? Do you really, really care about your decision making when it comes to your health? Now, there are those who will sit back and say that, the doctor didn't tell me that. And in actuality, he did, and you just didn't understand what he was saying. Or you were intimidated to say, hold up, wait a minute, pump your brakes, explain that to me in layman terms. Now, when it comes to healthcare decision making, it is your responsibility to understand what is going on with your health. It is your responsibility to assist that physician in making decisions with you, not for you, but with you. You can't leave everything on the doctor. You have to take responsibility for your own well-being. Your doctor is there to practice medicine. That's what they do. They practice medicine. And the majority of us think that because they have an MD behind their name, that they know everything out here and can tell you within a blink of an eye without running tests what is wrong with you. Now, they'll run tests to rule out certain things to come to a definitive diagnosis of such and such. But it is up to you, my friends, to become health care literate when dealing with your health, your child's health, your mother's health, your entire family's health. It is so important that you understand what they're saying and what is going on. Now, when I speak of healthcare literacy, what I'm speaking of is the ability for you, the patient, to take control of your own well-being by making smart healthcare choices, improving your communication skills with the doctors, and giving them the information they need to advocate for themselves in a medical setting. Without health literacy, patients are the ones who can suffer real consequences. This extends beyond you, the healthcare consumer / patient. It is important that caregivers, family members, and yes, the public have the ability to understand what doctors and other healthcare providers are communicating to you. Now, if you're assuming that health literacy doesn't matter, and you're under the notion that all of your healthcare responsibility is placed upon your doctor, you, my friend, are very wrong. Why would you allow someone else, when you're in your right frame of mind, to make certain decisions for you when it comes to your health care? We have to understand health literacy is an essential skill set for anyone who interacts with the medical community. And since we're each responsible for taking care of our physical and mental health, health literacy is a necessary tool for everyone. Now, the importance of health literacy. The reality is that everyone needs health literacy skills to successfully find and access care, prevent certain health conditions, effectively manage those that occur, communicate your needs, understand your choices, and make informed decisions. A lack of health literacy can have consequences, as stated before, on both a patient's personal health and your family. On an individual level, a person may not understand essential things such as how and when to take prescribed medications, how to know when it is appropriate to go to the emergency room rather than a primary care doctor, or how to explain signs and symptoms they are experiencing. Now, from a public health perspective, reduced health literacy can lead to widespread consequences. Low health literacy is also costly for the country because when people don't understand health information and instructions, they are more likely to have worse health outcomes and unnecessarily use of emergency room services. So you see where I'm trying to go with this. When I return, we'll discuss how to improve your health literacy. Ophthalmology Associates, PC, Drs. Berman and Dr. Zuckerbrod, treating diseases of the eye and eye surgery. You can reach them at 313-341-3450. Look, I'm going to be perfectly frank with you. If you are a sports enthusiast, I bet you know every football team, the scores, the linebackers, the wide receivers. Or if you like music, I bet you know every song that your favorite artist has put out. But tell me this. What do you know about your own health care? Really? What do you really and truly, honestly know about your health care? Can you sit up and have a conversation with your doctor like you do about sports or music? You should be loving yourself, and you should be concerned about your health. You should research everything that the doctor informs you is going on with you. Even if he places you on a new medication, research it. But if you know more about sports and music than you do your health, we have a problem. And like I stated before, that's why I'm here. Unfortunately, up to 9 out of 10 adults can have limited health literacy, and this can be fluid. It can be more challenging to be health literate when we are sick or in pain. So even someone who normally has a high level of health literacy may struggle at times to understand and process health information. Now, before we get into how you can improve your health literacy, let's talk about how healthcare facilities can improve. Now, many healthcare facilities have adopted programs or systems designed to improve their patients' health literacy. The National Action Plan to Improve Health Literacy encourages alternate forms of communication, such as using simplified language or even videos that can be shared with the patients. It also outlines a universal precautions approach, which encourages healthcare professionals to assume all patients have a limited understanding of the procedures and information being relayed to them. Now, we know some doctors don't. They don't understand that. They will speak, and I've said this previously in a previous podcast, they will speak in medical terminology. You may call it medical jargon or jibber jabber. And the majority of the patients don't understand. And that's when you are supposed to step in and say, pump your brakes, doc. Speak to me in layman terms where I can understand what you are saying. It is that simple. What else? The healthcare professional can learn to relay and relate to each individual patient better. You can observe a patient and see and kind of get a feel for their background to see if they will understand what you are saying. They will give you a certain look. So doctors, when you get that certain look from a patient, ask them, do you understand what I'm saying? And if they say, oh, yeah, break it down to them in layman's terms. Anyway, you got to ensure that all patients, not just one or some, but all patients are receiving easy to understand information. Now, coming to you, the healthcare consumer or patient, you ever thought about taking a notebook with you to your doctor's office visits? Now, this is how you can improve your health literacy. You can write down what the doctor is saying to you. If you don't understand a particular terminology that the doctor is using, ask him to spell the word out to you and then tell you what it means. It is working jointly with one another for the best outcome for you, the patient. Now, healthcare consumer / patient. Have you ever thought about taking someone with you that could possibly understand what the doctor is saying? Because, 4 ears is better than 2. That other person may pick up on something that you did not pick up on. So it is best to always take someone else with you that could pick up on things that you may just say to yourself, oh, that's not important. I'll let that slide. Now, when people receive accurate, easy to understand information, they are better equipped to take care of their health and wellness. Now, do you remember in previous episodes I told you you should all have a copy of your medical records? That's right, you should. You should be looking over that information. So if you should ever have the need to go to emergency, you can either tell them or better yet, do this. Get someone to type out all of your diagnosis, your list of medications, all of the doctors you see, and you'll have it right on hand for your next, if you're referred to another doctor, your next doctor's appointment or your next hospital visit. It makes life much easier to say, here, this is everything wrong with Mary Beth. Here's her list of diagnoses along with the last surgeries she had and the last time she was hospitalized for this same problem. Here is a list of her medications and how Mary Beth takes them. And here is a list of all her doctors you can contact if you have further questions regarding her health. You see there? It's all a part of becoming health literate. It is all a part of that. Now, there are those programs which are helpful for improving health literacy on a national scale. But there are also steps that you can take to make health literacy a priority in your everyday life. Now, I just went over some, but I'm going to give you some more. Writing down, before you have an appointment, writing down any questions or concerns you may have for your healthcare providers ahead of time of your appointment, recording your appointments or taking notes as stated before that can easily be referred back to your doctor's instructions. Patients don't have to be on their own. If they feel or you feel intimidated about a doctor's appointment, it's appropriate to take someone else that you really trust that is not going to blab your business to every Sue Blue out there. Take them with you. Or even if you have a patient care coordinator or a home health nurse. Ultimately, you want to leave every medical encounter feeling informed and confident about any diagnosis, medications, or other instructions your doctor gives to you. Now, another good strategy is to repeat all information back to your healthcare provider. That's right. in your own words, not his or her words, your own words, to make sure that you understand. This gives the doctor the opportunity to correct any miscommunication on the spot so you can feel prepared to take charge of your health after your appointment and beyond. Now, what is health literacy? Now you know that this ability to understand, take action, and medical instruction has an impact on an individual's family, and public health across the country. Once your eyes have been opened to the importance of health literacy, it might just permanently change the way you think about healthcare and the challenges facing those looking to improve health outcomes at a broader scale. Now, can you just imagine older individuals that don't have anyone to go with them to their doctor's appointments, and they don't understand what the doctor is saying? Just think about that. Can you imagine that? Just think about it if it was your own father, your mother, your aunt, your uncle, your grandparents, even your sister, brother, husband, wife. If they don't understand what's going on with what the doctor is stating, and they leave out of that doctor's appointment more frustrated and confused before they went in, that is a horrible feeling. And you may say, oh, it's easy for you. Yes, it may be easy for me because I have that background, but I also open my mouth. And the first words come out of my mouth whenever I'm prescribed a new medication. What are the side effects? Or if it's a medication that I've already know and have researched the side effects. No, I'm not taking that. You have to have a close relationship with your doctors. Don't feel intimidated. This is your life. This is your health. And more importantly, if you hold back information from the doctors, you can't blame the doctor for not treating that, because as I stated previously on episodes before, doctors are not mind readers. They can't guess what you're thinking and how you feel. I go into a doctor's office, and I'll give you an example. My cardiologist, when I was in that lupus flare, he knew when he seen me that I have never looked like that before. And yes, I was moaning and groaning. I was in that much pain. He said the words out of his own mouth. I never seen you in this much pain before, Susan. So you have to have that relationship. Now, if your doctor is not one who can understand and relate to you, I have told you also, you have the right to fire them and hire a new one. Yes, you do. If your doctor is not communicating or responding to you in a manner that you like, amongst other things, you have the ability to always look for another physician. There is no harm in that. This is your life. Stick with me. And when we return, I'll give you a little more information regarding health literacy. You know, those of us with lupus experience hair loss, thinning hair, either from the illness or the medication we take. I have the perfect solution for you. It's called Vitalize. Yes, Vitalize can help you. They are in the business of growing healthy hair. They have a hair system that can help you, and even better, they have a new and improved edge control gel. That's right, ladies. There is no flaking. It lays down the edges and also protects it from heat. But wait 1 minute. Most importantly, the edge control has the award-winning hair growth ingredient retin sol. Addition to the 3-part scalp treatment system, there is a silk pillowcase for you to lay those growing locks on. Shampoo, conditioner, and multivitamin gummies. You can see reduced shedding in 2 weeks. You heard me. And most see results in 4. To see proof for yourself, go on over to vitalizehair.com. That's vitalizehair.com and use the referral link listed in the information box on this podcast. Now, let's recap on health literacy. What does health literacy include? Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. What does health literacy mean? Well, the Patient Protection and Affordable Care Act of 2010, Title V, defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. What are the 3 levels of health literacy? It's the basic, communicative, and critical level. Is health literacy a problem? Yes, it is. Limited health literacy is a widespread problem in both non-industrialized and industrialized nations. and it is mostly related to deficient reading skills. What are health literacy issues? Well, when organizations or people create and give others health information that is too difficult for them to understand, we create a health literacy problem. When we expect them to figure out health services with many unfamiliar, confusing, or even conflicting steps, we also create a health literacy problem. How is health literacy measured? Well, researchers have developed a variety of tools to measure and aspects of health literacy. Individuals' reading comprehension in a medical context. The tools are for the assessment of health literacy in speakers of English and Spanish, the languages most frequently spoken here in the United States. What's the difference between literacy and health literacy? Well, literacy is defined as a set of reading, writing, basic mathematics, speech, and speech comprehension skills. Health literacy is the bridge between the literacy and other skills and abilities of the individual and the health context. Are health literacy and mental health literacy related? Mental health literacy, arising from this concept of health literacy, is defined as understanding how to obtain and maintain positive mental health, understanding mental health problems and their treatments, decreasing stigma related to mental health problems, and enhancing help seeking efficacies. Now, how to develop health literacy. An important strategy for improving health literacy is to use plain language in both verbal and written communication. What are the benefits of health literacy? Health literacy is important because it affects an individual's ability to manage personal health, to navigate the healthcare system, share health history with healthcare providers, engage in self-care, and manage chronic disease and understand concepts such as probability and risk. Now, how do you address health literacy? The first step is to identify the problem. Number 2 is to slow down. Number 3, use plain, non-medical language. Show or draw pictures. Number 5, limit the amount of information provided and repeat it before moving on. Number 6, use the teach back or show me technique. Create a shame-free environment. And number 8, and lastly, build in safeguards. That's right. These are the steps that we all can take. And you know what? I have a tendency to use medical terminology quite often when I am placed in a medical setting or even when I do this podcast. And I'm going to have to learn to just use plain talk when I'm speaking with you, because some may not understand exactly what I'm talking about or referring to. And I try to break it down, but my brother called me over the holiday, and he was asking me several questions regarding my health. And he told my sister that all she is going to do is use medical language that the majority of us don't understand, and only she understands. And she could be telling us anything, so not to make us worry. And my brother said, "You ever thought about that? You ever listened to her talking when we asked her something about her health and she goes into that medical mode where she's using all that medical jargon where nobody understands?" And see, I'm at fault too, because I think when I'm speaking to them, they understand what I'm saying. Now, my other sister, Wanda, she has a medical background, but hers is in the eyes. And some things that I refer to, she understands what I'm talking about. But my brother and other sister don't. So I'm part of the problem too, and I promise that I will do better in speaking in plain language that you would understand. Stay with me, and I'll be back to close out. All right. Now, to answer the question, why is there an episode coming out on Wednesday? Well, this is the reason why. You know, I informed you guys that I was in a real bad flare in November, and it has been really tough for me to bounce back. And I've been having problems with my gastrointestinal system. I received a call on New Year's Eve from the GI specialist, and I was informed that they spotted something on a CT scan that I had taken, I think it was last week, the end of December, somewhere around there, and that they had to move a procedure that I was scheduled for on January 21st to January the 6th. So, as you, my friends, have been listening to this podcast, I scheduled it to come out at exactly the time that I would be rolling into the operating room. And I wanted to just show you how important it is to know about your health care and to become health care literate. Health literacy is so important. And lastly, I want to leave you with this. Self-empowerment is seeking the solution rather than fixating on the problem. You know, for every problem there is a solution. I thank you so much for joining me on season 4 of my story, Living with Lupus podcast. I will hopefully see you guys on Friday. Take care and make sure you send those positive vibes my way. Talk to you on Friday. Bye-bye.